Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 103. Why Medicare for All is better than direct contracting. Direct contracting has more than one meaning in healthcare. For this episode, I will define direct contracting as follows. Direct contracting is when employers contract directly with physicians groups, or hospitals to provide their employees and families a range of medical services. The standard healthcare payment model in the United States works by contracting with a health insurance company to provide care. So the payments travel from the employer or employee to the insurance company, and then from the insurance company to the physicians or hospitals. In direct contracting, the payments would travel from the employer or employee directly to the physicians or hospitals. Health insurance companies are removed from the payment model since payments go directly to the medical providers. Now, some people argue that direct contracting is superior to the standard payment model, and I agree with that to a point. This podcast has often explained the problems and horrors associated with health insurance companies. A really large horror is that the insurance companies override the physician's recommendations and deny care. Direct contracting solves that problem since there is no insurance company. In addition, the physicians can be paid more and the companies can pay less since the insurance middleman is eliminated. Of course, Medicare for All solves that problem since it would eliminate almost all insurance companies, thus eliminating the overriding of physicians' recommendations. However, when we look at some of the other claim benefits of direct contracting, Medicare for All is superior. First, one of the main drawbacks of direct contracting is that your health insurance is still tied to your employer. This means if your employer decides to change doctors or hospitals, you may have to change your doctors. If you change your job, you may have to change doctors. Finally, if you lose your job, you may lose your coverage. Now contrast this with Medicare for All. You would never have to change your doctors because your employer changed their mind, and you wouldn't need to change your doctors if you changed employers. Now contrast this with Medicare for All. You would never have to change your doctors because your employer changed their mind, and you wouldn't need to change your doctors if you changed employers. Finally, if you lose your job, you are still covered. Medicare for All wins on every count. Another problem with having your employer contracted directly with physicians and hospitals is that you may only be covered in your local area. Would you personally be responsible for your medical costs if you are traveling and needed medical attention outside of your local area? It's a strong possibility with direct contracting. Direct contracting proponents also make the argument that companies can create tailored health plans. These are plans that can be tailored to the specific needs and demographics of a company's workforce. This means that every company gets to negotiate what is covered and what is not. If an employee has an unexpected medical problem, it may not be covered. Another problem with tailored health plans is that it will increase administrative costs for doctors and hospitals, since every company could have a different plan. That would be similar to the mess we have with our current healthcare system. There are so many different plans that the administrative cost of following all those different plans is huge. There are so many different plans that the administrative cost of following all those different plans is huge. Another argument that proponents of direct contracting make is that it will allow access to employee health data and that allows businesses to identify trends and create health initiatives specifically for their workforce. It would also allow businesses to identify employees or their family members with high medical costs and fire the employees to reduce costs. Another problem with this argument is that most business people would prefer not to have to worry about medical issues. And I doubt that they would want to spend time or money analyzing the health trends of their employees. The business owners and managers would much rather spend their time focusing on how they can improve their businesses. Medicare for All allows organizations to focus on their businesses instead of health issues. The last issue that I will cover today about direct contracting is the out-of-pocket costs. Since the deductibles, co-payments, and co-insurance that employees would need to pay would be negotiated with each separate contract, it's possible that healthcare would remain unaffordable for employees, leading to the same problem with our current healthcare system where patients skip care because they can't afford it. Medicare for All removes this problem since it eliminates out-of-pocket costs. So, while direct contracting might somewhat improve healthcare by sometimes taking health insurance companies out of the equation, it would also keep many of the problems that exist in our current healthcare system. Medicare for All eliminates these problems, making it the better and superior solution to direct contracting and the other problems with our current healthcare system. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.